Today topic of discussion is primary intention and secondary intention of wound healing. Whenever there is wound on skin based on the nature and size of the wound, the skin wound heal by two process. Okay, so whenever there is wound on skin based on the nature and size of the wound, skin heal the wound by using two process. It can be healing by primary intention or it can be healing by secondary intention. The primary intention is also called as primary union. Secondary intention is also called as secondary union. So primary first intention or primary union. What is primary union and secondary union? So the primary union, wound clean. Okay, if the wound is clean, primary union, if the wound is clean, uninfected, surgical incision approximated by surgical suture. Okay, so it is referred to healing by primary intention. So injury involves only the epithelial layer. So here injury involves only that epithelial layer. Here that wound become clean and uninfected surgical wound. Okay. Next one is secondary intention. This wound is large tissue defect. So here large tissue defect here never involved in the, here only epithelial layer only affected. We knows that scar formation steps. What are the steps? Whenever we have injury, first process hemostatic, that means blood formation, primary and secondary blood formation. Then it causes inflammation, cell proliferation, then formation of granulation tissue, then healing by deposition of connective tissue. So these are the steps. Discuss how the skin wound heal by primary and secondary intention in this series. First discuss about primary intention. This is skin, epidermis and dermis. Now in here, okay, now here incision, which is clean, uninfected and surgical incision. Okay, here clean uninfected surgical infection here. So this just a representation showing clean uninfected surgical condition, and we know that this type of wound heal by primary intention. So what happened during this process? First step, we know there is hemostatic block. First step, hemostatic block, which stop bleeding and support migrating cell into that injured site. Okay, so the hemostatic block which stop bleeding and support migrating cells. Okay, so migrating cells into that injured site. Initially it is fibrin clot. Okay, initially here fibrin clot. Next, what happened in the next 24 hours? The inflammation started. Inflammation started means inflammatory cells will come. Okay, so inflammation started, where we know that in that acute phase of inflammation lot of neutrophils. So here lot of neutrophils start coming towards the site of injury. You see lot of inflammatory cell here. Partially neutrophils towards the site of injury, In case of injury is clean surgical incision. Now what happened in the next 24 or to 48 or 24 to 48 or mitosis being to appear, these cells mitosis will appear. Mitosis cells start to proliferate and then progress towards one another, and then it form a thin cover above the dermis. So here it form thin cover above the dermis. So it just start approximating and then form thin cover above the dermal surface, and then it start uh, up cover the wound surface. Okay, it cover their wound surface. So the epithermal region cover the wound surface. We know that cell proliferation involve the native epithelial cells. It involve the vascular endothelial cell, and it involve in fibroblast. So here fibroblast, vascular endothelial cells and fibroblast involved in here. First one is native epithelial cell. Squamous epithelial cell proliferate. They approximate and then they form covering the wound. Okay, covering the wound over the dermis. Then over the next 3 to 7 days, formation of granulation tissue. Formation of granulation tissue. Then over the 3 to 7 days, 7 days, these there is a formation of granulation tissue. Then angiogenesis, a lot and lot of blood vessels. So see here, a lot and lot of blood vessels. So here only lot and lot number of blood vessels. So that blood vessels start forming along with the deposition of these inflammatory cells, and the mediator released by these inflammatories are the one which is important for granulation tissue to form. This happened in first week. So what happened in the subsequent week? There is deposition of connective tissue. The epithelial regeneration is more than what we saw in first week. There is a scar. Okay, there is a scar above it. Then over a period of time, the vascular and granulation tissue, which was highly vascular, diminish its vascularity. Then the fibroblasts start to proliferate. So here fibroblasts start to proliferate, laying down of collagen. So collagen started. So this is what happened in 2 to 3 weeks. So finally at the end of 4 weeks, there is a clear cut deposition of connective tissue in the form of scar. So scar formation, the cell become less in number and more collagen. Okay, so here more collagen is laid, and this collagen is particularly a type 1 collagen or fibrillar collagen, which is seen in scar of that wound. So it formed that scar of that wound. So this is happen in healing by first intention. Scar is not really very thick, it is very thin scar, and then the epithelium has completely regenerated. Epithelium completely regenerated. That is how wound healed by primary intention when it is clean and uninfected. Now let's understand the same mechanism if this is a large defect, that is secondary intention. Secondary intention, if large defect, so this is referred to as wound healing by secondary intention. And the secondary intention where the injury is bigger, larger, wider defect. It is filled with necrotic debris. Okay, it is filled with necrotic debris and inflammation. Initially, as we saw earlier, homostatic blood with fibrin blood, again lot of inflammatory cell also accumulated. So here lot number of inflammatory cell accumulated. Even inflammatory phase there will be too much of inflammatory cell. So here too much of inflammatory cell, and then proliferation also too much. As in the primary intention, what we saw, it start proliferating, migrating towards one. Okay, another approximating, and it sorts of cover, but of course this might take more time if there is inflammation ongoing, in infection ongoing. So large defect have larger granulation tissue, so large amount of granulation tissue form, and the same 3 to 7 days. So if it is not infected, look at the cell proliferation begin, and you have a thick scarf there. Okay, thick scarf there. And in the next 2 to 3 weeks, just like what we saw in primary intestine, no, large proliferation of fibroblast, laying down of collagen. Then this collagen is too much because large scar. Okay, large bigger scar as compared to that primary intention. In the next 2 to 3 weeks after formation scar, some of these fibroblasts assume the responsibility of being contractile. They refer to as myofibroblast. They started contracting the wound. So that's that what is called wound contraction. Myofibroblast, they start contracting the wound, so we called wound contraction. You can easily make out that there is depression on the surface of the wound. So this is what happened wound healing in secondary mechanism. Here also fibrin, type 1 fibrin, then fibrillar type 1 fibrin 4 weeks. So overall summary for primary and secondary intention. Primary intention, clean wound. Here large defect. Here both are homeostatic black. Then fibrin black and inflammatory cells, look at that amount. Here too many inflammatory cell. Granulation tissue also larger granulation tissue, more fibroblast proliferation in secondary intention. Then bigger scar in secondary intention. Next, what happened in that wound strength? If that normal tensile strength is regained after a wound, absolutely no. Okay, normal strength, absolutely no. What happened at the end of first week? Only 10% of that normal wound strength will be only 10% that of normal, which is rapidly increase over the next 4 weeks. Then it is slowed down at the end of 3 months. If the wound strength will be maximum 70 to 80 percentage only. 70 to 80 percentage that of normal. No wound can achieve 100 percentage normal strength. Okay, if normal tensile strength is regained after a wound, no. Okay, only 70 to 80 to 70 to 80 percentage only. No wound can achieve 100 percentage of their strength.